Hello, Miss Belinda. How are you doing today?
Good, thank you. How are you?
I'm doing good. So last time we talked about plaque and brushing, and I just want to ask you, how is your brushing going? How has it been
It's
this
pretty
week?
good. I'm using the method that you told me about, the Bass method, and then also angling the toothbrush up toward the gums.
That's very good. I can tell that you're improving because your plaque and bleeding score have reduced. So that's really good. That was part of our short-term goal that we discussed last time. So awesome job. Your plaque score was a 3.5. It's now reduced to a 2.4. And then your bleeding score was 62%. It's gone down to 45. And remember that we're trying to get that plaque score down by 0.5 and that bleeding score down by 20%. We're going to talk a little bit more about that today, so that's really good. So what we're going to do today is we're going to go over periodontitis and flossing. And I've picked these topics out because I think that these are really good for you personally and for your oral health. So we are going to get into that, but first we're just going to discuss some long-term goal number 2 and then the short-term goals that go underneath it. So long-term goal number 2 is to halt the progression of perio disease by reducing the bleeding score to 0%, which we're already working towards that goal. And then some of the short-term goals are to understand what periodontitis is and the cause of perio, reduce bleeding score by 20% at each visit, and then demonstrate proper flushing. But I always say that, flossing technique. So, do you have any question about these goals?
I don't think so.
And they feel attainable to you? Not anything you'd like to change?
No.
Okay, great. So it seems that you've really been doing your part at home, which is what we talked about last time. So I'm going to do my part here today, teaching you about what you need to know, and then you keep going at home doing your part. So let's get into it. What do you know, if you know anything about periodontitis?
Not much. Gum disease.
Gum disease, that's right. So here is our slideshow. We're going to go over a couple of questions, starting with what is periodontitis, which you said is a gum disease, which that's correct. You can see in this picture here, it says stages of gum disease. So perio actually gets into 4 stages. But let's talk about what it actually is. Periodontitis is a serious gum infection that damages the bone and tissues that support your teeth. And it has an advanced stages of gum disease, like you can see here in this picture. So yes, it is a disease. Let's see, what are the signs and symptoms of perio? If you can look here, you can kind of see some of the signs and symptoms. Can you think about what that may be?
Bleeding.
And inflammation.
Yeah.
Yeah, so some of the signs and symptoms would be red and swollen gums, gums that bleed easily, gums pulling away from your teeth, that's called recession, bad breath, definitely don't want that, and then you can lose your teeth and change how your teeth fit all together. So we definitely don't want to lose our teeth. That's really why this is extremely important. You don't want it to get to where there's tooth loss. What would cause perio? Can you think about maybe like what we talked about last time, and then what would cause perio?
Not brushing properly or not brushing enough, or just overall not taking care of your hygiene.
That's right. It's just truly comes down to just bad oral health. That's correct. So it's a buildup of plaque or bacteria that stays on the teeth and gums too long. Poor oral health. Really, just some people with the lack of knowledge. I think they try to have good oral health. They're just not doing it the right way. Smoking, which does not affect you, but for some people. And then genetics and certain health conditions can also increase the risk. And then our last question is perio reversible or irreversible? What do you think?
I'm going to say irreversible.
It is irreversible because it's bone loss. So once you lose the bone, you cannot grow bone back. So that's what makes it irreversible. So good job on that. So that's basically all we're talking about today with perio. Do you have any questions?
No, I think so.
Okay, so basically just to sum up what we were talking about, there's different stages of it. What it basically comes down to bone loss. It's recession. You can see that in that picture right there. It's inflammation. It causes bad breath. It's something you definitely do not want to have. So although it is reversible, our job is to halt the progression. You don't want it to get any worse and lead to bone loss. So up next, we are going to talk about flossing. So are you ready to move on?
Sure.
All right.